The questions: what is chronic fatigue syndrome, CFS? What is myalgic encephalomyelitis, ME? What is ME/CFS? What is CFIDS? What is post-viral fatigue syndrome? And what is SEID? These are in essence all the same question. And this shows you how misunderstood the illness is. So in this video, I'm going to explain to you what ME/CFS really is. And in the process, we're going to bust some of the terrible myths that increase the emotional and physical suffering of people experiencing ME/CFS and tell you what you can do to help reduce that. It's a shame that people can't even agree on a single name for the illness. While some people argue that these are different illnesses or subgroups, it's actually more of a difference of naming convention, with people in Europe and the UK more often using the term myalgic encephalomyelitis or ME, and people elsewhere using chronic fatigue syndrome or CFS. Post-viral fatigue syndrome was born from the experience where people start to develop CFS after they experienced a virus. So whilst it is possible to subcategorize the illness based on predominant symptoms and how the illness starts, and specifically define it as ME or CFS, I'm predominantly going to refer to it as one illness, ME/CFS, as does the Center for Disease Control and many specialists that treat the illness in the US and around the world. The confusion has really come about due to a lack of understanding of what causes the illness when it was first labeled as chronic fatigue syndrome. That name suggests that it simply means that the person is chronically fatigued. But in fact, ME/CFS is a multi-system illness, and it produces an extensive list of symptoms and dysfunctions that affect most bodily systems. This can be especially frustrating and difficult for medical doctors because many of the symptoms are also associated with other diseases. The Center for Disease Control lists the primary symptoms as profound fatigue, post-exertional malaise, which is where symptoms get worse after activity, unrefreshing sleep, cognitive impairment, so that's problems with thinking and memory and attention, which is sometimes referred to as brain fog, and also orthostatic intolerance, which is becoming lightheaded, dizzy, weak or faint when you go to stand or come up from sitting up. However, in my experience, people often develop unrefreshing sleep, cognitive impairment and orthostatic intolerance over time as they're ill with this illness. And one core symptom not listed as being core, which most people tend to experience, is immune dysfunction and other neurological symptoms. So here we're talking about things like swollen glands, flu-like symptoms, low immunity, and neurological symptoms like sensitivities to lights, smells, and other sensations. The best way to understand what ME/CFS is to realize that it is a multi-systemic illness. That means it affects multiple systems in the body, including your nervous system, your endocrine system, your digestive system, and numerous other bodily systems. Because ME/CFS is a heterogeneous illness, meaning that it manifests differently in different people, sometimes the illness is actually seen as a wastebasket diagnosis, or not a real illness. And with so many of the symptoms difficult to measure, and based on patient reporting, the myth that the illness isn't real or that patients are hypochondriacs or crazy or depressed has also been created, and it's still prevalent in some circles. Now, not only have I had this illness myself, but I have also interacted with thousands of people who experienced this illness. And I can categorically assure you that those kind of myths are simply not true, and they're not fair. The illness is real, and so are the symptoms. Anyone can experience this illness, and people can have different symptoms. different progression in their experience of the illness, and different severities. Patients often think that their experience is unique until they learn of others that have the same symptoms as them. And ME/CFS isn't as rare as you might think. You can check out the website on the different estimate rates, but given the very low diagnosis rates, the real figures of people that have been affected by the illness at some point during their lifetime may actually be a lot higher. Now, the illness can also be triggered by a range of things. These can be things like infections, or they can be physical trauma, or even psychological trauma. Whilst the way the symptoms are created is progressively better understood thanks to the efforts of medical researchers, there's still a lack of agreement regarding the root mechanism that needs to be resolved in order to allow people to recover. Having said that, the World Health Organization has actually categorized ME as a neurological disorder since 1969. Now, it's important to note here that neurological is different from psychological. So in no way are they saying that the illness is imagined or not real. So ME/CFS is a real physical illness with a very large range of symptoms and is still not well understood by the wider medical community. What's worse is that people are sometimes not believed about their illness being real, or sometimes poor information is spread suggesting that the illness is purely psychological or not real. And this can be very upsetting and unhelpful for people experiencing ME/CFS. But you can make a difference, and you can help change how the illness is perceived by letting others know what chronic fatigue syndrome really is and posting a link to this video, or embed it on your blog or website and give us a thumbs up below. For more details on what chronic fatigue syndrome is, you can also visit the website on the link below, and of course you can subscribe to the YouTube channel and watch the full series of videos, including videos on diagnoses, treatments and recovery from the illness. Hope you leave a comment below, and I'll see you in my next video.